COVID response protocols. Our district has established a series of COVID-19 response protocols in the event that someone tests positive, is identified as a close contact, or if they become symptomatic. In this section, we will review common scenarios that may occur and the follow-up actions students, staff, and parents can expect us to take. In the event that a student or staff member tests positive for COVID-19, that individual will be generally asked to quarantine for 10 days. One of our district contact tracers will be notified to assess the impact, and appropriate communication will be issued based upon our findings. During our impact investigations, contact tracers will work to assess the impact levels in the building and classrooms and will consult with our pandemic preparedness team to determine appropriate next steps in accordance with the most recent IDPH CDC guidelines and board policies. Communication in these instances will fall into one of two categories. The first is classroom, bus, or building impact communication. This communication will be more general. The second category is close contact communication, which will go to individuals identified as close contacts. If someone is identified as a close contact, that individual will quarantine for 14 days and will be asked to monitor for symptoms. We will begin enhanced monitoring of their classroom or buildings, and appropriate communication will be issued based upon our findings. If a student or staff member becomes symptomatic during the school day, the individual will be referred to the building health station, where a nurse will conduct a health screen. From there, we will implement appropriate protocol if symptoms are suspected to be COVID related. Finally, if a student or staff member becomes symptomatic outside of school, that individual is asked to stay home, report their absence, and consult their health care provider.